The session that we are in is Strengthening Child Care Home Providers in Emergency Preparedness. Your presenter is Charlene Caldwell. Charlene is a program manager with the Division of Early Care and Education. Ms. Caldwell has worked in several areas of child care licensing, including working as a licensing specialist. Currently, Ms. Caldwell works with licensing staff and providers across the state. Charlene holds a master's in management from the University of Phoenix and a bachelor's from Winthrop University. Ms. Caldwell is originally from Florida and has been in the great state of South Carolina for 29 years. Ladies and gentlemen, please welcome your presenter, Charlene Caldwell.
Good morning, everyone, and thank you for joining us. And thank you, Ms. Fitzgerald, for that wonderful introduction. I hope everyone has had a wonderful summit conference so far. So today we are going to talk about emergency preparedness in your child care home. That is either a family child care home or a group child care home. So our outcomes today, we are going to understand what emergencies and hazards may be in your child care home, know the importance of having an emergency preparedness plan, be able to develop that emergency preparedness plan that is specific to your child care home. All right, so let's just have a little discussion. If you were a family provider, what would your response be if some parents raised questions, about your ability in an emergency, or if they had safety concerns in your child care home? And how would you address that with your parents? Would you say to them, yes, I have a great ability in my emergencies because, hey, I have an emergency preparedness plan. I've been revising that plan and reviewing it. The children and I do several drills. So how would you do those, answer those questions or concerns? What if parents raised some safety concerns in your home if they walked in and they saw something that they felt was not safe? So these are some things that we need to make sure that we are going around our homes, outside, inside, and making sure that they are safe for the children. So let's talk a little bit about what we consider an emergency. Of course, fire. People always think of fire as our only emergency that we may have in childcare. But we also have to be concerned about hurricanes, tornadoes, flooding. If anybody remembers the flood of 2015, it affected a lot of areas of South Carolina. And to be honest with you, a lot of people, including DSS and the state, other state agencies, were a little unprepared for that flood. So that's why we want to make sure that you have flooding in there, thunderstorms, earthquake. If you've realized, we've heard some little minor earthquakes across the state in the last. We've had maybe 4 or 5 over in the Jenkinsville area near Fairfield County. Excessive heat and cold, that's winter, and also going out in the summer of South Carolina. And then we want to make sure we have included health emergencies, and that is due to the COVID-19 pandemic. So we want to make sure that we are including these emergencies and health emergency injuries, allergic reactions. So if you want to put in the chat box, let's talk individually of your childcare home. Let's think about some potential risk for emergencies that you may have in your home. Are those some common weather conditions in your area? Proximity to railroads, highways, nuclear plants? We have 10 counties in South Carolina that are close to nuclear plants. So if you're in one of those 10 counties, 10 miles from that nuclear plant, you need to have that in your emergency preparedness plan. the layout of your home, the ages and needs of the children in your care, and other potential risks. So let's see, Ms. Fitzgerald, if anybody puts anything in the chat box of some potential risks that they have in their own family child care home, and we can talk about it.
The only thing that has popped up right now is tornadoes.
Tornadoes, yes. Um, so you must be in an area that maybe has them quite often. So yeah, you need to make sure you have that in your plan and have your evacuation for that tornado specific to your family child care home. Anybody else want to share?
Gas leaks.
Gas leaks, yes, that is very common too. Um, and, you know, through the years, the gas companies have made different changes to their heaters that you have. You know, you may have an older home and you may have a heater that may need to be replaced because now the new heaters have to meet certain codes that have that cutoff valve. So if there is a gas leak, then it cuts off and it gives off that smell of the rotten eggs. They put that in there so you, as a provider or a homeowner, knows that there could be a potential gas leak. So that's something we want to make sure that we have the correct heaters in our homes, and as well as some barriers around those heaters that the children cannot get a hold of them. So great. So let's talk a little bit about hazards. We talked earlier about emergencies, and those were weather related, some of them, and then some of them were health emergencies. So let's talk about some of those hazards that may be in your child care home or around. And those are the nuclear evacuation. I talked about that earlier. And so your plan should be approved also by your local emergency department. And so if you're in one of those areas by those nuclear plants, then of course you have been in conversation with your emergency department to make sure you do have a evacuation plan for that. And we just talked about that, the gas, utility shortages, electrical, gas, and water. What is your plan if your electricity goes out for the day? What is your plan if the water is cut off for a reason? You know, the city may be doing some work and they let you know that you're going to be without water 4 or 5 hours. So you have to have a plan for that. And so those chemicals and hazard materials, we want to make sure that all of those chemicals are locked and away. We want to make sure we do both. We want to make sure that they are away from the children as well as locked. I use this scenario a lot of times with the cabinet, and you put a lock on the cabinet and you open it, it's locked, you can't get your hand in it. But we have to really realize, is it my hand that's going in it, or is it the hand of a toddler or a hand of a 1-year-old or a 2-year-old? Their hand is very small. So we want to make sure that it is away from the children as well. And we want to make sure those chemicals and hazard materials are labeled. Illness and food safety. The food is labeled and in safe containers, only serve the safe food. Crime. We want to make sure our outside areas are safe. Your doors and windows are locked. And then a hazard could be abduction. Make sure you have a plan that only authorized or approved people can pick up that child. And then also, of course, have a plan unless in case someone comes to pick up that child who is not approved. I give this out a lot of times at my trainings that, we're outside with the children and we may have a child that we're saying, Johnny, don't do that, Johnny. Johnny, don't do that. And so you're constantly outside. You may be constantly calling the children's names, but we have to be careful with that because a lot of times when people walk by the sidewalk or walk down our streets, they hear us calling those children names. So you have to have a plan in case someone like that comes to your house and calls Johnny. They know the names of the children because you're calling them outside. So we have to be careful with that. All right. So when we talk about emergency preparedness, we want to make sure we have emergency supplies. And if you have to be sheltering for, a certain number of hours, some situations may happen that they may be 24 hours. We want to make sure we have enough food, water, and other items for each child and adult. And then you want those supplies in something easy that you can carry. So that's a backpack. That's one of those little sling backpacks that you pick up somewhere. And so you can see by my pictures some items that you may want to have in there. That's some flashlights, water, some little healthy snacks for the children, all in that easy to carry, to grab and go bag. All right, so let's put in the chat box some items that you think would be good to put in a to-go kit. Who would like to put in the chat box some items?
Flashlight.
Yeah, flashlight, as well as batteries. That's something we want to continue to check. Good. First aid kit. Yeah. Oh, I'm sorry. Go ahead.
Yeah, there was a first aid kit and batteries.
Yes, great. And the first aid kit, we want to make sure that we are checking that, because if you've used things out of it, you want to make sure you replace it. Yep, great.
Water.
Mm-hmm. Yep. So good ideas. And so in your
one more, I got snacks.
Yep, snacks. Yep, because you never know how long you may be sheltering, that you may be out of your home. So you want to make sure that you have those items for the children. So we want to make sure in that to-go kit, that ready-to-go bag that you can just put on your shoulder and get out quickly, you want to have the updated children's contact information. Because if you are evacuating with those children, you want to make sure you have the parent or guardian or approved person that can come and meet you where you are with those children in order to get them. And we talked about first aid kit, fully supplied, and water, nutritious snacks, crackers, and so books, and then some type of entertainment, because we know the children may be uneasy, they may be afraid. So you want to have some type of entertainment, books and stuffed animals to make the children feel a little bit more safe and comfortable. And then we talked about that, the battery operated radio, our small TV, and of course the batteries to go in those things. And of course, always check to make sure the batteries are still good. How many times have you tried to find a flashlight around your home and you go to turn it on and the batteries are not any good? All right, so we are going to talk about what an emergency preparedness plan is. Why do I need a plan? What does my plan need to have? Who needs to see my plan? And how should I review it? So child care licensing requires an emergency preparedness plan. And it is important so that you, your family members, and the children you care for know what to do in that emergency. Your plan should have emergency drills, and then you should practice those drills, conduct them with the children and your family members. We want to do at least 2 times a year, and we want to do all the drills. We don't just want to just stop at fire, even though fire is important, but we want to do tornado, the thunderstorms, evacuation, shelter in place, earthquake. We want to make sure that we are conducting all of those important emergency drills. And then after those drills is a great time for you, the provider, to review it and revise, because you may have done the drill and then you was like, something quite didn't go right this time. And so that's your opportunity to revise it and review it. If you want to send it to us in licensing to ask, hey, does this really make sense? Or am I missing something? You're welcome to do that. And then you want to do that at least annually or more. And so it more could be after the drill, but at least annually, because situations, children change. You know, the last time you did your emergency preparedness plan, you may have had all 3-year-olds. And so this year, you may have all infants and toddlers. So then your plan is going to have to be for how you're going to get those ages of children out. So really review it if your situation or your children change. And then it should be shared with your parents so that they are aware of your plan. All right, so let's help to develop a plan, and we're going to talk about what your emergency preparedness plan must have. And so your emergency preparedness plan must have medical emergencies. And when we talk about medical emergencies, we want you to really be intentional and think about any medical emergency that you think would require immediate attention by a healthcare professional or a reason for you to call 911. And so some of the examples we have are broken bones, the child is unconscious, allergic reaction, that's food, that's ant bites, that's, heat, non-breathing, severe bleeding, deep cuts, or some unexplained rash. But you may be thinking of others. These are just some examples. But it should be specific to your child care home and the children you enroll. You may want to add or revise as you enroll a child because some children may already have some special medical or special needs issues. So you want to make sure you're revising those medical emergencies to include that if you care for children with some of those medical or special needs. And then the part B of the medical emergency, is you'll need to list the steps you will follow in that medical emergency. So if your step is, I'm going to call 911 no matter what, then that's what your step is. And so this is where we want to also think about having an emergency person available. Now, that emergency person doesn't have to work with you every day. But you could have an emergency person that you could summon in the emergency. That could be one of your household members, because as you know, they do have the background checks, so they are able to care for the children. But, if you have an emergency person that you're going to summon, that person does need to have the appropriate background checks before you summon them. Okay. So that's why it's always good to have that already thought about, to have that person fingerprinted and central registry completed, so you can summon them if you have an emergency. You can be caring for that child that's having the emergency, and then your emergency person or your household member can be watching and caring for the other children. And so your evacuation plan must also have, your emergency preparedness plan must also have evacuation plans. And that is in place evacuation. And when we talk about in place, we're wanting to know where in your house will you take the children during that emergency, that tornado, that storm, or that other emergency that doesn't make you necessarily leave your house. On-site evacuation is where on the property will you take the children in case there's a fire or other emergency that makes you leave the home, but that you can still stay on the property. And so we see the difference there. In place is inside the home. On site is still on your property or premise, but you're not inside the home. All right, and then relocation site. It's if you need to move the children to a place close by. If the city or county or fire, police comes knocking at your door, hey, we have this situation in your neighborhood, and we need for you to evacuate the neighborhood. So you need to have a relocation site. And this could be an organization. This could be a parking lot. If the Piggly Wiggly is out of the neighborhood and you want to go to their parking lot with the children, but that should be in your plan. Where are you going to take those children? And then this is also the part that you want to communicate to your parents, because we all know that situation that's happening in your neighborhood could be 5 minutes, could be 10, 15, an hour. So, do you really want to stay in Piggly Wiggly parking lot with your 5 or 6 children for an hour or 2 or 3? And so, this is the part of the plan that really should make sure you're communicated to your parents so that you can have their contact information, send them a text, call them and say, hey, we've had a situation at our relocation site. Can you or somebody that's authorized come pick your child up? And so that is an important part. And then, of course, your evacuation site, if you are in one of the 10-mile radius of the nuclear plant. And those are the following counties: Aiken, Allendale, Barnwell, Chesterfield, Darlington, Fairfield, Lee, Lexington, Newberry, Oconee, Pickens, Richland, and York. Okay. But if you are in that 10-mile, you have been communicated by your local emergency department and given some steps of what you would do in a nuclear evacuation situation. All right. So your emergency preparedness plan must also have, like we talked about, that relocation site. You want to post that in your home, make sure the parents are aware, put it in your parent handbook, post it on the bulletin board, refrigerator, all of that. Your emergency preparedness plan must also have your procedures of how you're going to evacuate. This is where I talked earlier about having that authorized emergency person available to call in for an emergency. We make sure you've reviewed that plan with that authorized person, household members, so that they are aware what to do. And then, of course, you need to have a procedure of how you're going to release the children to those authorized adults. Includes the safeguards to prevent inappropriate release to any unauthorized persons. We talked about that child contact information. And so we want to make sure that you're having either a notebook, or you can have a little file folder that you're carrying all of that children's information. This is good if you have the designated physician or hospital where the parent wants that child to go in case of an emergency, medical emergency. The child's favorite toys, their food, the things they like to do, because you want to make the child feel a little bit more comfortable if there's an emergency going on. Comforting techniques for the child, a description for the health provider if there are any special health care needs. All of that needs to be on the child's contact information. And then any circumstances from the parents or guardians that may have a delay of them picking up their children. You know, are you in an outlying area of Columbia and the parents work in Columbia? That may be a little bit of a delay of them coming to get their child in an emergency. Do they have frequent out-of-town travel? Are they working as first responders or in the hospital? So if it's a medical emergency or something going on citywide or countywide or neighborhood-wide, they may not be able to come get their child because they may be at the hospital or attending to that emergency. So those are some good information that you would want to make sure you have in that child contact information. All right, and your emergency preparedness plan must have an evaluation checklist. And I've put it on the screen here. And this is out of the emergency plan template. So if you are a family provider, you know that licensing gives you a template that has all of this information in there, and you would just need to complete the areas of the template and make it specific to your family child care home. You are welcome to use the template That's why we developed them. We have them for all the facility types, or you can develop your own. It's up to you. But this is, you need to have this in your evaluation, in your emergency preparedness plan, a checklist. And you can see it's the contact list for the children. We've talked about that emergency information, those supplies. We want to make sure your cell phone is charged and ready to go, that first aid kit. We talked about the flashlight, the batteries. We've just given you some checklists that you can go over to make sure that you have, and it's all ready to go quickly in that bag. And then, of course, we want to make sure that we review at least annually and revise as needed. So let's talk about some procedures. And we've talked a little bit about this earlier. I just want to make sure that we, have a clear understanding of these procedures. So sheltering in place. In your emergency preparedness plan, we want you to have a plan of sheltering in place. And so if you're outside, your procedure would be everyone needs to go inside. You need to gather the children up. You need to make sure that you have accounted for all the children. And your family members use some type of little tracking sheet to make sure that you have all the children. Have everyone go to the identified shelter location inside your home. Ensure you have those emergency supplies in that shelter location, or you gathered them up and taken them with you. And then, of course, you want to listen to the radio or the news of what's going on to make sure for any instructions. And so your procedure for evacuation location, it could be different based on the emergency. And so your home evacuation for fire, smoke, electrical, gas could be your backyard, across the street. If it's a neighborhood evacuation, like for gas or weather, that would be out of the neighborhood, but still close. Out of the neighborhood, which could be nuclear. You would want to go wherever law enforcement designates. That may be a church, a school, a business. Ensure that you have permission from that organization, and the parents are aware so they can come pick up their children. All right, so let's talk about who can help you identify some emergencies or hazards or threats. You may want to ask questions to your local county emergency management, parents, first responders. Local schools and school districts can help you with that. The State Department of Health, especially when it comes to those health emergencies. Your insurance carrier, your utility company, local businesses and industry personnel, child care organizations, for example, Child Care Resource and Referral out of USC. Other home-based providers that are in your area. You may want to join a family child care network, and y'all can talk about your emergency preparedness plans together. Hey, what do you do if you have different ages of children? If you have children with special needs, what are some of your plans that you have in place? But of course, you are the best person to identify those emergencies and hazards in your home. A lot of times we want to say about those hazards, if your area is safe, we want to get down on the children's level. We walk around all day long up here, but we want to sometimes get down to the children's level on that floor to make sure that things where the children are safe. Because it could be all kinds of things. We want to make sure our plugs have safety plugs in them and covers. We just want to get down to the children's level to ensure our entire area that the children are being cared for in is safe for them. All right, so your next steps after you leave this training today, we want for you to look around your home for hotspots. And when we say hotspots, those are those areas that may be unsafe, Those are those hazards. That's your emergency plan that we want to make sure you've looked around your home for those hot spots. Identify those emergencies, hazards, or threats to your home. Look around your home to ensure that it's safe. Identify members from the community or from licensing or resource, child care resource and referral network that can assist. Develop an emergency plan specific to your home if you have not already completed one. And if you have one, then you want to make sure that you review it to ensure you have what is required. We want to make sure we practice those drills with the children and your family members, because we want your family members to be safe as well. And then, of course, we want to review and revise the plan after those drills if necessary. So I want to open up the chat to see if anybody has any questions or anything else they want me to go over, or if they want to perhaps ask questions what's in their emergency preparedness plan, if they have one developed, to see if I can answer any questions for them. Or any questions you have regarding family child care homes at all, regarding with licensing. Anything? Everybody has an emergency preparedness plan? That is terrific. So earlier when I talked about allergic reactions, so one thing in licensing for family child care homes, if you are familiar, I will talk about this a little bit. If you are familiar with the DSS Form 2909, which is the consumer parent statement, that's where your parents complete that their child attends your family child care home, and they put the hours and the days of the week that the child attends. We are revising that form to include any food or other allergies the child may have. So you will see a revised form of that coming out soon, probably in the next renewal packet coming out in 2022, because we do need to have a way for parents and for you as the provider to know if children have some type of food or any other allergic reactions. So that is something new. We are also revising the Guide to Family Child Care Home Guide to Success that was developed with the Child Care Resource and Referral and Child Care Licensing. We've done some revisions of that to include areas that family child care home need to have in their policies and parent handbook. And some of those are transportation, the food and allergic reactions, of course, the authorized pickup, and so it was some things that we knew in licensing that we needed to make sure family child care providers were doing, just to ensure another level of health and safety for the children that you're caring for. And we know that a lot of times the family providers already have those policies, which is great, because as you know, the regulations for registered families were developed in 1993. And those still the current regulations we have for registered family providers and licensed providers. They have not had any changes. We did revise some, and we have an advisory board for child care regulations that were reviewing them at the beginning of COVID. They were at the end of reviewing, and then COVID. So you may want to be on the lookout of 2022. We are really trying to start that conversation back up with the advisory board so that those regulations can hopefully be changed. Because 1993, a lot of things have changed from caring for children from 1993 till 2021. So we want to bring up that level of care, facility type, family and licensed child care, family child care homes. And so that's why we wanted to change the regulations.
Charlene, we have one question. Is a foster home required to be licensed?
So, yes, foster homes are required to be licensed, and that is a different area of DSS. That is, we have foster home licensing at DSS, and that is a different area, but yes, they are required to be licensed. And we also have people who are foster home parents and their home is licensed, and they are also registered or licensed family providers. You actually are allowed to do both. However, if foster home licensing gives you a permit for so many children, then those are still the only number of children that you can keep for your registered or licensed home, which means if foster home license gives you a license that you can only care for 4 children, then we also can only license or register you for 4 children. And we all know that any children in the home under 12 are counted in your enrollment. So we do have a lot of people who do both and have been doing both for a very long time. And it is allowed. We just, make sure that we, know those requirements. So if you are wanting to do foster home licensing, which I think is great, they're always looking for more people to have their home license to care for those children. And so you'll just have to, of course, let them know that you do have a registration or license with us in child care licensing. And you can do both. But if they place children in your home, then of course you need to include those children in your enrollment if they're under 12. And if they place children in your home that are 15 and above, then you are required to do the background checks on those children because they are in your home. All right, good question. Anybody else have any other questions that are related to emergency preparedness or registered or licensed families or child care licensing as a whole? So I will say this, and I'm thinking Ms. Johnson and Ms. Espinoza, Ms. Bowers, and the other people on the training today. I hope you are family providers. If not, it's okay. But we did send out an email from child care licensing about training hours because we realized with the pandemic and a lot of really child care centers having staffing shortages. So if in 2020, we waived some of the training hours. And so we have waived some of the training hours for 2021. But no worries, if you went on and did all of your training hours and now we're waiving them, that's okay. We are able to still move forward some till next year. So for example, if you are a family provider and you were required to do 10 hours of training, and now you got this email from us in December and we're waiving 5 of them and you've done all 10, that's terrific. We are going to still give you those credit for the 5. We're going to move them to your next training year. So, woohoo! You'll start off the year in the positive of already having 5 hours of training, and then you'll just have to go on from there and get 5 more. I am not sure that if any training hours are going to be waived in 2022. And so the agency has not made a decision of 2022 yet, but we did make that decision of 2021. And that was for all facility types. So if you are a center director and you had to do 20, we waived 8 of those, I think. I don't have the email in front of me, so I'm sorry if I don't get that quite right, but we waived those. But if you've already taken them, no worries, we can move those to 2022, so we can start off with hopefully everyone having training hours. And then, of course, everyone, I'm sure, is aware of the stabilization grants that will be coming out. The agency has sent out a couple emails regarding that. I believe there is a webinar that's coming up one day next week where we will talk a little bit more about the stabilization grant. I believe it's going to be an application on a portal for you to complete. So it's going to be a little different than the other grants that were dispersed previously. Because this stabilization grant came with a little bit more requirements from the federal government. So be on the lookout for that webinar to attend. I think the email went out the other day for you to attend that and get more information, as well as looking for the application portal opens up for you to apply. All right, does anybody have any other questions that I can answer regarding child care licensing? All right, so let's see if, let me just see who I have today. Maybe I should have started off with that. I'm sorry. So, Miss Espinoza, are you a family provider? And if so, can you tell me which area you're in of the state? Oh, thank you, Ms. Fitzgerald. She put the link to the webinar in the chat box. So thank you for that.
You're welcome.
Oh, okay. So you're a parent, educator, home visitor with First Steps. Okay. All right. I imagine with First Steps. Yeah, that's great. I was on the Newberry. I was on the Newberry County Partnership First Step Board for many years when I was a child care director. And so, yeah, I've been on the board a whole lot. And even when I was a child care director, and then when I came even to child care licensing, I continued on the board for a long time. So, yeah, I've been kind of involved with First Steps on the other end of First Steps for a very long time. So great. Anybody else want to share? Is Miss Johnson? I think we had a Miss Johnson. Do you want to share if you're a family provider or in what part of the state or um, what you do? We have to give you, yeah, I know, a couple minutes to type it in. Okay, not a provider, but information can be used in my own home. Well, great. Well, thanks for attending today. So, have you ever thought about being a family child care provider? And then I think we also have a Miss Bowers. Do you want to tell us who you are and what you do? Okay, so you work for First Steps in Finance. Well, good. It's always good to have somebody from all areas of First Steps on the call. So great. Thanks for attending. So some people may know we do have different types of family child care home. We have registered and we have licensed. So a lot of people ask questions about what actually is the difference between the two. So I will give a little history. Before 2014, the biggest difference between licensed and registered family child care home was licensing only made a visit to a registered family if there was a complaint. So we had registered families that we had never been into their home, didn't know how many children they were caring for, didn't know if the children were safe. It was a it was a paper process. They did have to be fingerprinted and child abuse and neglect and sex offender check. They did have to do the background checks for them and people in their home. But as you can imagine, if we had never been in their home, we didn't know who was in their home. So, unfortunately, through the years, we had many complaints, and unfortunately, we had many children's deaths in registered family homes. So, the legislatures decided to um, uh, make something different and required us to start making inspection visits into registered family homes. And so we started that. And so that really was the biggest difference between the two facility types. Um, and then after that big difference, the other one was registered, like I said, was a paper process. We didn't come out, we didn't do any of that. You sent in your paperwork every year. We reviewed your paperwork and we sent you a registration. And then license, of course, had to do a little bit more. They have to have a fire and health inspection of their home. And we go out and we inspect it before we give a permit. We inspect it at every renewal. And then a licensed family goes through the renewal every 2 years, like other facility types of centers and group childcare homes and registered faith based. So those were the differences. And so we at licensing, once we started making that inspection visit to the registered families and now to all facility types, we also knew we needed to help increase that level of care. And so that's where we developed the Family Guide to Success to help them with their policies, their business plan, their procedures, and different things like that, and then help them with that inspection. And another thing we did is we also do a pre-registration visit into the home before we give them a registration, because we were making visits into all the other facility types. And so we added in that to the registered family, and it's really a technical assistant visit for our specialists to get out there and see the home to help the provider um, probably find the best place in her home to care for the children, to make sure that that place where she thinks they should be is safe, to make sure that the outside area is safe, and help her through some of that before we give a registration. And that has been very helpful to us as well as the providers, um, the applicants. It gives them a chance to see licensing, to know what we're going to look at when we come out to their home. And so it's been a really good process for everybody. They get to meet their licensing specialists, and so and build that just beginning relationship of us both being on the same page of caring for and making sure that the children are healthy and safe in that home. And so another thing we also did to kind of build up that facility type and make them kind of on the same level with all the other facility types is we also do a renewal visit. And so that is announced like it is with the other facility types, but it's given the provider a chance to hand us their paperwork instead of them having to mail it in. The mail is slow, they don't have to pay for postage, and all of that. We're able to look at it, make sure it's correct, so we can get back to the office and we're not having any issues. Things get mailed in, we look at it, it may have something missing. And so it was just kind of a back and forth. I'm sending it back to you. She may, to the provider, she may have not gotten it. So we just decided to do things a little bit different to make it easier on the provider. And then one thing that we're doing with all facility types is the agency has decided to pay for all background checks at this point due to the pandemic. So if anybody is hiring anybody new for fingerprints and they need fingerprints completed, or they need the child abuse and neglect, sex offender completed background check, the agency is paying for all of those. So that has been a huge assistance to providers, that they don't necessarily have to worry about that cost during the pandemic. So does anybody else have any questions or anything that I can answer for them, or they want to put in the chat box? All right. Well, I thank you for your time and attending the Strengthening Family Child Care Home Providers and Developing Emergency Preparedness Plan. It is something that's very, very important, and it's very more important than it just being more required, because we want to make sure that people that are caring for children in any facility type across South Carolina have the appropriate plans in place and practiced with the children and the staff to make sure that those everybody can be safe in an emergency. And I shared this with people when I was a child care director. We actually had a fire in our facility. It was contained to the kitchen because we were fortunate to have a building that the entire building was fire rated. So that means we had the crawl space above each room. So if a fire or smoke happened, it was contained to that area, and then the part above, the ceiling area above. But at the same time, we were a large facility. We enrolled 200 and about 80 some children. So you can imagine it was a lot of children to get out during that situation. But like I say, it was contained to the kitchen, but I had to get my kitchen staff out. And one kitchen person wanted to be the hero and stay in there. And I'm like, no. But to evacuate 280 some children, almost 30 staff. It was a lot. Um, but I'm going to tell you one thing that that situation taught me as a director is I had this wonderful emergency plan that I had my name in it, and I didn't do well in that emergency. I found out that I was the person that just, I mean, I didn't fall apart or fall on the floor and have a temper tantrum like that, but I found out that I needed to review my plan. And even though the meat of it, I needed to put other people in those parts of the plan. So it gave me a chance to see my teachers in action, to really say, oh, Miss Susie, you did really well during the emergency. I believe I need to put you in the plan to be in charge of blah, 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 and take me out of it. So, I was, at the time, we were very upset that it happened, but at the end of the day, I always look at opportunities for change, or everything as a learning opportunity. And that situation did show me that, yeah, Charlene, you're a good center director, but you need to have somebody else to be in charge of blah 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 in this plan. Um, and so it was a learning opportunity, and we were all safe. But at the end of the day, it was very nerve wracking. I really wanted to close the facility and go home for a couple days, which we couldn't do that, because we were safe. The fire came quickly, and it was contained. It was really a lot of smoke more than um, fire getting out of that oven. Um, but yeah, it really showed me that you got to review your plan. And so that's why I continue to say to people, drills are important. We were doing drills, but drills are a little different than being in an emergency situation. It really, being in that emergency situation really showed me the teachers that really could be a part of that plan, and they just did it so well. It was just water off the back to them, and me, I was of course freaking out. Um, so it was a good learning opportunity. But I thank you for allowing me to be part of your First Step Summit today. And as we embark on this wonderful season coming up, I wish everybody a happy holidays, and a wonderful December, and continue to be safe. And if we don't have anything else, I thank you. I have my information on the screen. If you want to reach out to me with any questions or any concerns or anything that you would like to know further regarding childcare licensing. So thank you again.